Hello, my name is Joan Cahill and it's my pleasure to give you this presentation on stress and work-related stress as part of the Safety in African Aviation 2021 conference. So I'm a human factors researcher at the Centre for Innovative Human Systems at the School of Psychology in Trinity College in Dublin in Ireland. And much of my research investigates the health and well-being of aviation professionals, in particular looking at the relationship between health and well-being, performance and safety. And as part of this, looking at the lived experience of the job, stress and work-related stress, measuring well-being, stress coping and resilience, integrated well-being and safety culture, and assessing well-being risk within safety management systems. The starting point of much of my research has involved an investigation of well-being, looking at the three pillars of well-being. This is the biological, the psychological, and the social. So the theme of this presentation is on stress and work-related stress. And it's important to know that work and work-related stress has an impact on our wellness. It has an impact on our health. But in turn, our health and well-being has an impact on our work. So we need to manage the relationship between our work and our well-being and how our well-being influences our work. And from the perspective of an aviation professional, how it impacts upon performance and safety. So what is stress? Well, stress is a negative reaction that people have to aspects of their environment as they perceive it. Being stressed is a state. It's not permanent. And stress, in fact, is part of life. It's a normal experience. Work-related stress is stress caused or made worse by work. And it occurs when a person perceives the work environment in such a way that they feel unable to cope. There's this reaction of feeling overwhelmed, maybe. As noted by the United Nations, there is a relationship between work and our health, our mental health, and the relationship is with work-related stress. So work stress mediates this relationship between work and our mental health, our well-being. In our research, we've looked at sources of work-related stress, and we've tried to categorize them according to the three pillars of our health: the biological, the psychological, and the social. You see, many exist in the biological pillar, but many indeed also exist across the psychological and social, and some of these span both, so they're not mutually exclusive categories. And you may have heard these referred to as psychosocial hazards. So we did a survey in 2018 and 2019, so pre-COVID, and we looked at sources of work-related stress for pilots in particular, and we found some sources as more occurring more or less frequently, in particular irregular hours, antisocial hours, and a divergence of values between employees and management. People vary in relation to their ability to cope successfully with stress, including work-related stress. So the practice of healthy behaviours strengthens our resistance to stress. And ideally what we need to do is we need to swap or substitute maladaptive coping with more adaptive coping. So an example of maladaptive coping might be, overeating, or maybe gambling, or maybe engaging in recreational drugs. So we want to swap out some of those negative or maladaptive behaviours with more constructive or positive behaviours. So common stress coping strategies include exercise, the practice of relaxation techniques, seeking social support, and participating socially. So interacting with friends and family members and also work colleagues. In our research, we found that the coping strategies most associated with lower depression levels, so having an analysis of the survey that we did in 2018 and 2019, and this was with over 1,500 pilots, we found sleep and physical exercise to be very positively correlated with lower depression severity levels. Culture is obviously an important component of work stress, and from the perspective of organisations and employees, it's important in terms of creating effective stress interventions. So what we'd like to see from an organisational side is a positive managerial approach to work stress and looking at health and safety culture as an enabler. So in aviation, there's often talk of a culture of safety. So we'd like to see a culture of health and safety and the management of work-related stress. There's some links here if you want to look at the presentation later to some guides on managing your well-being and stress. I suggest you look at the Aviation Professionals Guide to Wellbeing, which was developed partly through our research and working in collaboration with colleagues from the Flight Safety Foundation, and also to our website. We're delighted to be launching a new survey which investigates the wellbeing for aviation professionals. We had a survey last year and we've published the results, so please give your feedback. The link is here. And just to close on a note of managing stress and wellbeing, that airplanes are maintained to ensure that they are airworthy. We are no different. Thank you for your time.